The Talar tilt test is an important orthopedic examination performed by healthcare professionals to evaluate the integrity of the lateral and medial ligaments of the ankle, particularly following an inversion injury. The test is named after the talus bone, one of the key bones within the ankle joint. When an inversion trauma, such as a common ankle sprain, occurs, the lateral ligaments can be overstretched or torn. This injury is where the Talar tilt test is particularly valuable. By moving the foot and ankle in specific ways, the test helps assess any instability in the ankle joint, which can indicate a damaged ligament. To use our Talar tilt test, follow these steps. Download our Talar tilt test from our Carepatron platform, which you can find in the link in the description. Firstly, position the patient. Have the patient sit comfortably with their foot and ankle hanging freely off the edge of the examination table. This unsupported position is crucial for obtaining accurate results. Adjust foot position. The patient's foot should be placed in a position of mild plantar flexion, typically about 10 to 20 degrees. This is the natural resting position of the foot and allows for a better assessment of the ankle's ligaments. Stabilize the leg. Using one hand, the examiner should stabilize the patient's distal lower leg. This is typically done just above the ankle bones. Perform the inversion. With the other hand, the examiner carefully inverts the hind foot. Inversion refers to the movement of the sole towards the body's midline. Palpating the talus. The examiner then palpates the lateral aspect of the talus, a bone in the ankle. They are checking for any tilting or laxity, which would indicate potential ligament injury. Excessive tilting or laxity under inversion stress constitutes a positive Talar tilt test. This suggests a ligament sprain or tear. Lastly, compare sides. The examiner compares the finding from the affected ankle to the unaffected one. This is done to understand the extent of any potential ligament damage. The Talar tilt test isn't quantifiable. Instead, it relies on the clinical judgment of the healthcare professional performing the test. Here is a sample of our Talar tilt test, which you can find on our Carepatron platform. To find our Talar tilt test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.